I am so happy to announce that we are 700. I want to say thank you, gracias, shukran, grazie, благодаря, спасибо, danke, merci, and that's all the words I know in different language to say thank you guys for being here, liking, sharing, and subscribing. Please do share and recommend my channel if you find this information useful to you. I am creating this video today real fast before I go to my doctor assignment. I am being really busy during COVID. I don't know about you guys, but for me it has been like hectically busy. I start work really early and I work really late, so I have different clients in different continents, and this keeps me extremely busy. So I would just have a special days to record it. Like I decided to do it real quick right now. I'm trying to keep up with you with your requests. Thank you for writing me a comment, telling me what you need. I know a lot of you requested how to practice as an interpreter. I also have been prepared a cultural awareness video, and I am going to share another hack about simultaneous interpreting, and there's so many projects that I have in my head to share in this YouTube channel, so stay tuned. You're not gonna be disappointed. I am gonna do my best to keep you informed and to keep you ready for your medical encounters or medical interpreting sessions or business interpreting or whatsoever related to interpreting and translating. This is my video number this is the last video that I'm gonna record. I should have recorded in English first, but instead I did this video with Sophia, I'm sorry, forgive me, Sophia. So if you click up here, you're gonna find the video Spanish English version with her. This is only the English version. And if you do want to practice in this video in your target language, I'm gonna say the word and you're gonna repeat it on your target language while you were listening this video. I repeat, these videos are series of videos which I call Bilingual Assessment target language bilingual proficiency target language test or exam or whatever you want to call it. And this is the last video. Is going to be video number 14. If you watch this 40 series of videos, I guarantee you that you're going to pass your bilingual terminology test if you know all the terms that I mentioned in those videos. So the companies that decided to test all the interpreters after the COVID, of course, they do this because there were many interpreters available, and they decided to do some kind of a selection and pick the best interpreters for their encounter. Of course, you guys know more interpreter, higher competition and prices kind of go down. Some companies try to bring the minimum payment to $20. In the basic languages that are most searched, like Spanish and Russian and so on. Do not sell yourself cheap, please, guys. Whoever is watching me, know your worth. Have in mind that this company take minimum between 80 and 275 an hour for your languages. So do not feel bad to request 35, 45 and more dollars an hour, because these guys are making money out of you. And if you do happen to work in a project with me, you know that minimum I pay is 30 to 35, depending on the language. And I also pay a little bit more for translating, but I want you to provide excellent services. If you are, let me tell you, I just started a project and I'm competing for these services that I want to provide. So if you do provide Spanish, Arabic, German, French, Russian, Bulgarian, Macedonian, Ukrainian, of course, and English, and I'm Italian, please do feel free to send me your resume. You're gonna find my email on the YouTube channel below. Make sure whoever send me you guys emails, make sure you send me updated resume. If you don't know how to do a good resume, make sure you watch my video how to find or make a great interpreter resume. Either way, send me your resumes. I would like to add a few more interpreters to my list. even though I provide myself 5 of those languages, I would like to add some people to help me in different projects, so feel free to contact me. I also like to share, I'm so sorry, this is going really longer than I was planning. I like to share, guys, do not send me this insane request for prices. I had a gentleman send me an email and he asked me 3 times the regular salary in his country. I mean, if you ask me to pay you more, you have to have good reasons, okay? So let's come back to our medical interpreter, and let me clarify for you. Good reasons means you are like better in something. You provide higher knowledge, higher specific. Don't just come and ask me, give me $100 an hour. You know I'm not gonna do that. But in a reasonable, I can pay a little bit more to someone that I enjoy working with, that is punctual, that is professional, and so and so on. So please feel free to send me a resume. Okay, we're talking about bilingual medical interpreter terminology test or bilingual interpreting test. It's called bilingual target language proficiency test, or STAT, or PCC STAT for everything, or it's even STAT 5, level 5, that is only medical terminology, all related to medical interpreter, guys. So if you're gonna work in medical field as a medical interpreter, have in mind this suggestions that I'm gonna give you here. Number one, there is 2 types of tests. One test, it's included few scenarios, and the second type of test include terminology, which are 25 words in English to the target language, and then from the target language into English, which is total of 50 words. The second 2 parts include medical patient scenarios. Either way, if you have the word as a word only, they say to you word, for example, colonoscopy, and you have 1 to 3 seconds and you have to say it in the target language. Let's say it's Bulgarian. In Bulgarian, this is colonoscopia. So, or same in Russian, colonoscopia. So have in mind that you have to know this terminology words that I'm giving you in these 15 videos. Like even if I wake you in the middle of the night and I ask you this word, you have to know it. Like it have to come right away to your mind. You don't have much time because they read the word and they go to the next one, and you have to know it. You have to say it. Okay. So in order to pass the test. So now I'm gonna give you a scenario number 1. Remember, those tests are consecutive, so when you have the patient doctor scenarios, they're all going to be consecutive, so you would have time to take a small notes. Again, if you want to know how to take a great notes, check my video above. This is a lot of videos talking, or one part is talking about abbreviation and another is talking about note taking for medical interpreter. There will be name, numbers, and phone numbers. I do advise you to take those down because you're gonna forget them until the phrase is over. And now I'm gonna give you a few words. Have in mind that you can check this video above. Me and Sophia make this video, English, Spanish. So if you want to take part of this project to make those videos in another languages, please do feel free to contact me. I will be more than happy to have you in my channel, to promote you as an interpreter, to promote you as professionalist, where you can give a variation of interpretation of those terms. Midwife, that's the terminology. I am not gonna read the full scenario. You guys, can you imagine, no? For example, hello, my name is Lynn and I'm your midwife. Okay, I like to let you know that your lab results come pretty well. You can imagine how the scenario go. So I'm just gonna give you the key term which you must know. Progress, or then pregnancy, delivery or natural delivery, fallopian tubes, abdomen, extracarpal. You can add here vaginal delivery, induced delivery, C-section, miscarriage, and abortion. So if you have an OBGYN, which is something that you often gonna interpret, especially if you're a female, they love to call a female interpreters for OBGYN. And if it's a male prostate check, of course there will be a male interpreter to make the patient feel more comfortable. This is number 2 scenario called medical history scenario. I repeat, if you want to be successful in your exam, you have to hear those terms and know them right away. High blood pressure, diabetes, lung disease, COPD, OBGYN, and heart disease. I give you 6 types of scenarios, and they're all related to questions. Number 2, result test, chest x-ray, CAT scan, MRI. So either way, they are going to talk about the results, about disease. Number 3, hospital, complications, emergency room, surgeries. Number 4, medicine, pills, prescription, over-the-counter pills, anything like that, right? Number 5, itching, rash, food allergy, medical allergies, and any other kind of allergies. Number 5, when was your first period, pregnancy, C-section, hysterectomy, UTI, inflammation, blood in the urine, cyst, ovarian cyst, fallopian tubes, ovaries, uterus, STDs, prostate, and urinary problems. And then scenario number 3, again, I'm giving you keywords, make sure you know them. Infection, vaccine, check, symptoms, ID number, medical record, vaccine, cough, take a breath and hold, exhale, or any other kind of body movement. Very often the third scenario is shorter of this test and includes some kind of a physiotherapy or anything else similar to that. That was my last video, which was I supposed to put first, but forgive me, I don't. That would be your video number 14. You're gonna see it for the last, but that gives you example how these exams, bilingual exams, are structured. So have in mind that they are gonna go like this. They're not gonna tell you, hello interpreter, this is Dr. Patient scenario, or maybe they will tell you, okay, hello Jen, very nice to meet you, I'm your midwife, and I would like to let you know that your lab results come normal. And then you're gonna have the other person, which is the target language, will say, oh, thank you very much, doctor. I would really like to try to have a natural delivery. And then the doctor will respond, oh, okay, well, was it natural delivery the last time or you had a C-section? So this is more or less how this scenario will go on. Thank you for being here. Thank you for liking, sharing, subscribing. I hope you have a wonderful day and take care. Bye-bye.